The next film we're going to talk about is the supine chest X-ray. All this really is an AP frontal chest X-ray taken with the patient lying down. And all they do is slide an X-ray film underneath a patient who is lying down and take the X-ray from above. Now, in theory, you should never take a supine chest X-ray because it is often of low quality. When a patient is lying down, the abdominal contents push into the thoracic compartment, compressing the lungs and giving you a poor view of the chest. However, there will be times in which the patient is so sick or unstable that you're not going to be able to perform a better type of chest X-ray. And so you're forced to do supine film because it's better than nothing. And just as an example of the lower quality supine films, here's a PA film and a supine film of the same patient who is completely healthy. Notice that the mediastinum looks larger on the supine film than it does on the PA film. And also notice on the supine film that everything looks compressed and just not as clear. And so clearly the supine film does not look as good as a PA film. The last film we'll talk about is the decubitus film, which is a fancy way of saying a frontal film while you're laying on your side. In terms of standards, a left decubitus film is when you're lying down on your left side, and a right decubitus film is when you're lying down on your right side. So in this picture here, this is a right decubitus film because we're taking a frontal X-ray with a patient lying on his right side. The reason you take a decubitus film is usually one of three things. Number one, to see if there's free fluid. Number two, to look for air. And number three, to check for obstruction. Now, the decubitus film is the most sensitive film for looking at fluids in the lung, but more importantly, it's used to determine if fluid flows freely or is trapped by something, aka loculated. If the fluid does not flow freely, then this is a sign that the patient may have more than just fluid in his lungs, which drastically changes your differential and treatment options. And so we can see that example over here on the film. And so what I've drawn here is the fluid in a patient when you put them in a decubitus view. And it flows as you would normally expect normal fluid to flow. The second thing that you can look for on the decubitus film is air. And so normally air rises. And so in this example, air would rise to the side opposite of the fluid. And the last thing you can do with a decubitus film is to check for lung obstruction. And so how you would do that is you would have to take both a left and a right decubitus film. And so let's say the patient has an obstruction in his right lung. And so normally there's the dependent lung, which is the lung on the bottom, and there's the non-dependent lung, which is the lung on the top. And the non-dependent lung compresses the dependent lung because of gravity. And so what that does is that it compresses the dependent lung and it forces air out of it, causing it to shrink and appear smaller on a decubitus chest X-ray. And so that's how you can tell that there's no obstruction in that lung. However, if there is an obstruction in the dependent lung, when the non-dependent lung compresses it, air can't get out. And so as a result, the dependent or lower lung does not appear smaller on the decubitus film. And so whenever you take decubitus films to look for obstruction, the decubitus film that has the dependent lung not changing in size is the side with the obstruction. And so here are our take-home points. Number one, the lateral chest X-ray, or a film through the sides of a patient's chest, is usually taken in tandem with an AP or PA chest X-ray, and is used to help localize lesions, look behind the heart, and look at the lung bases. The supine chest X-ray, or an AP film taken when a patient is lying down, is something you want to avoid if you can, but there will be situations in which the patient is so sick or unstable that your only option will be to take a supine chest X-ray. And finally, the decubitus chest X-ray, or a frontal film while the patient is lying on his side, is useful for looking for free fluid, air, and obstruction. Thanks.